welcome to the RCORP Lecture Series on working with vulnerable populations. In this video, we will discuss working with pregnant clients. In this video on working with pregnant clients, we will discuss potential issues that may arise in the treatment setting. Some issues include psychological and emotional, physical and medical, social and environmental, as well as preparing for the postpartum period. We will also review potential solutions and provide additional resources. Psychological and emotional factors may present in the clinical setting when working with pregnant clients. Hormonal changes can affect mood, energy, and concentration, sometimes mimicking or exacerbating anxiety or depression. Regarding identity shifts, pregnancy often prompts reflection on one's role, values, and life priorities. Ambivalence about pregnancy is common, even in planned pregnancies, and clients may feel guilt for having mixed emotions. Past trauma, including sexual abuse, miscarriage, or medical trauma, can resurface as the body changes or during medical exams. Solutions include helping clients normalize ambivalence and emotional fluctuations. For example, we may help them reframe "what's wrong with me" into "what's happening to me." We might also regularly screen for mood and anxiety disorders to monitor clients' affective states. Lastly, we can explore with clients expectations of parenthood and any perfectionistic or societal pressures. There are also physical and medical considerations to consider when working with pregnant clients. Fatigue, nausea, and pain may limit session tolerance and focus. Certain psychotropic medications may be under review. Clients could be anxious about taking or discontinuing them. Pregnancy complications or high-risk status can heighten anxiety and grief. Solutions include being flexible with scheduling and session length, and utilizing telehealth in later trimesters. With the client's consent, we can collaborate with other members of the client's treatment team, including OBGYNs, midwives, and psychiatrists. When considering social and environmental factors, it's important to understand that partner or family support may vary and that sometimes pregnancy exposes relationship strains. Clients may also face workplace stressors, including discrimination and/or financial strain. Lastly, cultural and/or religious norms may strongly influence beliefs about pregnancy and parenthood. Some solutions include exploring the support system to identify realistic sources of help postpartum. We can also work with clients to set boundaries and communicate needs clearly with others. We can also utilize motivational interviewing skills such as reflections and affirmations to validate the influence of cultural and system stressors. The transition after birth can be emotionally turbulent, and anticipatory work is valuable. Clients may underestimate how isolating or physically demanding early parenthood can be. Some solutions include postpartum planning, including emphasizing support, self-care, sleep expectations, and communication with partners. We might also normalize that attachment takes time and that bonding may not be instantaneous. We can provide psychoeducation about postpartum depression, anxiety, psychosis, intrusive thoughts, and reducing shame and fear. Jasmine is a 31-year-old client who is meeting with her therapist 3 weeks after giving birth. She tearfully says she feels like she's failing as a mom. She reports exhaustion, mood swings, frequent crying, irritability, and guilt for not feeling the instant bond with her baby that she expected. Jasmine feels anxious whenever the baby cries and worries something terrible might happen if she looks away for even a moment. She's also struggling with sleep deprivation, difficulty accepting help, and tensions with her partner. Jasmine says, "Everyone keeps saying I should be happy, but I just feel scared and empty." Some solutions include validating the client's distress while providing psychoeducation about how many people, such as new parents, experience emotional changes after birth. We can also discuss and assess the differences between short-term baby blues and more persistent postpartum depression and anxiety. We might also want to collaborate with her physician to consider additional supports, including possible medication or referral to a perinatal mental health specialist. We can work with the client on cognitive restructuring to challenge unhealthy beliefs that fuel guilt and shame. Regarding self-care, we can identify small, manageable steps to support self-care, for example, accepting help from others so she can rest. Here are some additional resources for working with pregnant and postpartum clients.